So what is oral appliance therapy? Well, oral appliance therapy is simply a way to reposition the lower jaw or the mandible. And by moving the lower jaw and the mandible forward, you're also moving the tongue forward, because the tongue is actually attached to the mandible right here in the front of your mouth. And as a result, by moving that forward, you're taking the space away and opening up the airway in the back of the throat. So the tissue that hangs down in the throat is separated a bit from the tongue itself. And that opens up that particular area. So what are the limitations of oral appliance therapy? It's simply that. It only works on the tongue. It will not do anything for a big neck. It will not do anything for nasal obstruction, or it will not do anything for a low-lying soft palate. So it's, in specific people, it will help. People who have more sleep apnea when they're on their back, when everything tends to fall back in the throat, those are the ones that tend to do the best with this therapy. And that's one of the things that we can identify from the sleep study, is that do you have worse sleep apnea when you're on your back than when you're on your side? We also look at the number of obstructions per hour, and that will also act as a guide as to whether or not oral appliance may be the first choice, or it may be a choice maybe made down the road once there's weight loss involved and we've dealt with some of the other issues.